Hi, everybody. Welcome to another edition of On Oshkosh. I'm your host, Cheryl Henson. Very happy to be joined tonight by two folks I don't think you guys have been on in the past, have you?
No.
Well, we're rectifying that this evening. So to my right, we have Jennifer Scholasky. She is the project manager for the Winnebago County Overdose Fatality Review Team. That is a mouthful.
It is a mouthful.
And so you're the project manager for that. And then to her right is Ashley Rumlow. She is the Community Health and Prevention Supervisor. She is also part of the Winnebago County Overdose Fatality Review Team. I'm going to say that so many times, it's going to be, I'll say it in my sleep tonight probably.
You know what? We call it OFR to make it a little bit easier.
Okay.
The OFR team.
OFR team. Very good. Whoops. OFR team. Okay, great. Or I'll just maybe say the team. So anyway, earlier this month, the Winnebago County Overdose Fatality Review Team, OFR, released its 23-24 annual report summarizing the local in Winnebago County fatal overdose data, themes, and recommendations for preventing more overdose deaths in Winnebago. I'm having trouble tonight. Overdose deaths in Winnebago County. So before we get into the statistics, tell me a little bit about this review team, how it came about, why did it come about, what it does, that kind of thing.
Yeah. So our OFR team started 6 years ago in 2018, and it really came out of the work of the Winnebago County Drug and Alcohol Coalition, which was out of the health department, and had some amazing leaders that saw that there was a need to address this epidemic. They had been looking at data in 2017, which was 34 deaths at that time, which we've had quite a bit of an increase since then. But it was a team of people. One of the leaders was a former chief of police, Kurt Leibold from UW Oshkosh. And he used to be a Milwaukee officer. And he had been part of a homicide review team and talked about the benefits of a process when you bring a multidisciplinary team together to review the life of, you know, in our case, someone who's died of an overdose death, and look as a community to say, how can we do better? Where are the gaps that we've seen? Where are the themes that we see from case to case? To be able to say, this is what we need to work on to save people's lives. So we have a team of 47 partners representing 35 agencies, law enforcement from every jurisdiction in the county. We have
and
healthcare.
We have a screen about that. So can we bring up the screen? I think it's the first one that has, there we go.
Look at that.
Wow.
So that's the team.
That's the team.
It's, you know, I think on screen they can probably see it, but I mean, there are a lot of people involved in this. I mean, certainly medical centers around the county, you know, police and fire, counseling services, the school district, Solutions Recovery is in there. There's a church that's in there. And I mean, obviously the county health department and other departments from the county, but there's a lot of people who are involved in this group. How often do you guys meet?
So we meet on a monthly basis to review cases of individuals. And, you know, after that, we also work on recommendations. So reviewing the cases is about probably a tenth of the work that we do because we're implementing recommendations. But I think the amazing thing about this team, and in this report we talk about the ripple effects of the work that we've done, it's everyone has different perspectives. And we all come with different backgrounds and different points of contact with people struggling with addiction. Yet we're able to come together and say, what do we need to do better and what can we change? So it's really an amazing group of, you know, people that are committed to making change in our community.
Okay. So if we can bring up the next slide then. What is this that we are looking at here?
So this is a lot of the work that we do. And I always say, I hope this diagram overwhelms you because every one of those ovals, I think that's kind of an oval shape, are recommendations that our team has made and that we have groups working on. The panel of the left of those rectangles are actually priorities. So in our report, we talk about what the priorities are for the next year and what recommendations we're working on with those. So it represents really all the work that we're doing outside of the reviews to try and make impact.
So you've got it on the left-hand side broken down into different sections like child trauma, mental health, referral to care and services, prevention and harm reduction, recovery support, and communication and engagement, followed up by the last one, which is social connectedness. And then, so from there, then we've got those arrows going to other things. Yeah. And does that signify then what things you need to do within that category?
Yes.
Okay.
Yeah.
All
Yeah,
right.
so for example, if I was to take the top one, because I think that's one that I'm really passionate about, is childhood trauma. Mm-hmm. And this has been a theme of our OFR for a very, very long time. And 3 recommendations that we've made that we're working on is the first one, thinking about CPS and the role that they play and how we can support the work they do, but also supplement it with other organizations in the community. One of the biggest successes of the OFR team has been our Handle with Care program, mm-hmm. which is a partnership between currently it started with a relationship between Oshkosh Police Department and the Oshkosh School District, expanding as well to Lourdes and Valley Christian, as well as the Sheriff's Office. In this past year, we were able to address childhood trauma county-wide. So every one of our cities has a program that they're working on, where every time kids have contact with a police officer, a referral is made to a school social worker to assess them for trauma and support them with care and other services they need. Okay. The final recommendation is the DEC program, which is Drug Endangered Children program, working with our law enforcement. So when they come into contact with families that may be struggling with addiction and drugs are unseen or children may be endangered, how to support those kids and those families. Okay. So that's just one row of the work that we do.
Of them. Okay.
Yeah.
All right. Well, then why don't we move on to the next section of the report here? Well, we can go past that even. There we go. So you said that the deaths were higher, and they certainly are. Last year, 47 in our county alone. Mm-hmm. And it says that exceeds the number seen in any other previous year. Why do you think? I mean, looking at it, there was a huge dip. I can't really
in 2013,
yeah. And then another kind of dip in 2019. Mm-hmm. But those were the only 2 significant dips. There were a couple little tiny ones, but those were the 2 significant ones. What do you think happened during those particular years that caused a dip? And obviously that would be something, if we could, nail down, you'd want to sort of replicate that. But then it trends back up again, mm-hmm. and now we're up to 47. So what do you think happened during those 2 years?
So I'm going to give you the shortest answer possible. It's complicated.
Oh, okay.
Yeah. So there are a lot of different reasons why we see these increases. And one thing that we'll talk about is drug trends. So when you start getting into 2020 and beyond, you'll hear fentanyl a lot. Mm-hmm. And fentanyl is the leading cause of overdose deaths in our community as well as nationally. So you'll see some of that as well, but it's also some of these other connections. So whether treatment is available, whether there are social determinants of health that people are struggling with. I don't know if you wanted to add.
I think your answer that it's complicated is really the best one. And yeah, we'll definitely see changing drug trends, which is going to impact what our overdose death statistics look like, and constantly changing services and knowledge.
So, go ahead.
So the only other thing that I'd say is because our county is, we have an amazing OFR team that we talk nationally. And, one thing we always say is, 47 represents people in our community who've died, which are family members, our friends, our sons, daughters, employees. But this is one metric. So many people are having non-fatal overdoses on a regular basis. And so this is one piece of the puzzle that we're trying to address.
Well, let's take a look at the demographics now, because that's pretty interesting. Look at that. 13 victims were listed as female, 34 were male. I found that kind of interesting. And then most of them were white. 4 were either Black, Hispanic, or American Indian. That is surprising to me, that, and it's not a racist thing, so don't send me hate mail. It's interesting that there would be so much happening with people of a Caucasian persuasion, not a persuasion, but of a race, than some of the others. I mean, does I don't work in the field, but does this kind of make sense to you?
Yeah, I think that, addiction is a disease that touches everyone and every family, every race, every socioeconomic status. And so I think what we see here is a reflection of our demographics of the county.
Oh, okay. Well, that makes sense.
And I think Ashley's point needs to be reiterated, because part of the work we do is breaking down the stigma of addiction. And I think there are a lot of people that think it's one kind of person that struggles, that it's a person in a dark alley, and it's not. We unfortunately have reviewed many cases of people. We've reviewed 70 people in the last 60 years, and I'll say you see everything, all different backgrounds. So, this is why it's such an important issue for everyone in our community, because it impacts everyone.
Yeah, so if we can take a look at the next slide then, because this breaks it down by, did we miss a slide? Or do we have to go back to that other one that showed the age groups?
I think the age group actually is, important if it's in there, because
it should be in there. Let's see if we can bring that up. It's the age groups.
And I can just start talking about the age.
No, that's not it, guys.
There you go.
There it is, right there.
So in the past few years, we've seen an increase of people dying between the age of 35 and 54. But this year, it is definitely trending younger. So the first time that we've had, someone under 20 die of an overdose death. So we're kind of putting a red flag on this, of making sure that people know, once again, it's not older people that necessarily may be dying, even though we have people over 65 that are dying as well. But really thinking about how overdoses are affecting our young people, our working people, our family people, all those different.
So the highest one, of course, was the 35 to 44 years of age. And then not too far behind that is the 25 to 34 years old, that grouping. And so help me understand, or help all of us understand, what is happening, do you think, between those two, the 25 to 34 and then the 35 to 44? Do we have some sense of why those numbers are so particularly higher than the rest?
I think the only thing I'd say is really thinking about some of those social determinants of health, of what's affecting people. So let's take housing, for example, because that's a big issue in our community, right? So if people are struggling with finding stable housing, maybe they're in an environment that they're surrounded by people that aren't positive influences or supported, or maybe the stress of housing is so much that you struggle with other things. What we see when we review these cases is we're looking at all those things. What's their education background? What's their housing? Do they have access to food? Do they have access to health care? Are they struggling with mental health?
All kinds of socioeconomic things.
Yeah, all those things.
All right. Okay. So now if we could go back to the slide that we looked at before, that seems to be out of place. There we go. So fentanyl is the primary cause. It was the primary cause in 31 of the 47 deaths. And I don't know. I think that's terrible, obviously. Cocaine is still a big thing.
So, Ashley, you want to?
Oh, and I'm noticing too that there's, like for the fentanyl, most of that was a multi-substance and a small, I just noticed that now. So what are they using in addition to fentanyl?
So what we saw, especially in 23, was not that people were intentionally using fentanyl. It's that fentanyl was being added into the other substances that they were using, and it was newish to our community, and people weren't aware that it was in their substance. And I think that's where we saw such an increase in overdose deaths.
Okay, can we bring that up again, please? So you're saying that fentanyl would be is the fentanyl the gray box?
So fentanyl is the top line with the blue and the gray. The gray at the end shows how many people died of just fentanyl. So it's the same as in the line below too. That's all people who died of cocaine toxicity. but there may have been other substances in that blue part, whereas the gray is just cocaine.
So with fentanyl, the majority of it is fentanyl that they're coming in contact with, maybe unbeknownst to them, and it's being used in conjunction with something else.
Yeah.
And then that smaller section there under fentanyl, the little gray box toward the right-hand side, toward the end, that is just when they're using fentanyl by itself, or, okay, all right.
So
Wow, that is, that's, those numbers and the types of drugs they're using are, I think, startling, really. Huh. Okay, well, let's move on. Let's see, we talked about the age groups. Now, you cover all of Winnebago County, and the weird thing is, when I was looking at stuff, there's a small sliver of Appleton that is considered Winnebago County. How that happened, who knows? But that would probably be a discussion for another show, and I probably still wouldn't get an answer, right? Because I don't think anybody knows how that happens. I had a friend who lives in one county, one city. She's got right across the street someone who's in a different city, and they're in different counties. It's like you live across the street. I mean, I realize the numbers have to start and stop somewhere, and the geographic lines have to start and stop somewhere. But it seems weird that one person and the other side of the street, they have two different things going on.
Yeah.
And it's got to be hard for emergency personnel, for
Certainly.
sure. But so in our county, what city had the highest number of deaths? Do we have a screen on that?
So we
There we
talked
go.
about the death rate per 10,000 population rather than a percentage, because the populations are so different in each community. So Neenah actually had that highest rate, and then Oshkosh in terms of the number of overdose deaths in each one of those areas.
Other than being interesting to look at, does that tell you anything specifically about the people who are ODing?
No, I think for me, what this says is potential for prevention and intervention, where we're meeting people and what resources are in those communities to help people.
Yeah.
It makes sense to me that the highest would be in Oshkosh, since that's the largest population. And so
Yeah,
many
but
of the
then you've
services
got
in the
that
county
death
are-
per rate that
Yeah.
where Neenah tops the list. And there's such a big difference in population between there and here. Initially, when I looked at this, ladies, I thought, okay, well, that makes sense because those are the highest populated cities. But then I saw the other number where City of Neenah has 4.7 deaths per 10,000. And I thought, oh, now I don't understand it.
When I look at this, what I see goes back to, what I said really early on in the show
The
is that,
population differences.
well, addiction touches everybody.
Right.
The disease of addiction doesn't discriminate. And,
Right.
I think we look at we make assumptions about what the city of Oshkosh is versus what the city of Neenah is, and all those different areas in our county. And the reality is that there's drugs and the disease of addiction in every one of those areas, and people dying by overdose in all of those areas of our county.
When we talk about these overdoses, are any of them suicidal in nature?
We actually did see an increase this year in suicide overdoses. So, they are different causes of death, or manners of death, I should say, accident versus not.
Yeah.
And so this past year there were 7 as compared to years before where it was 3 or 4. So we did see an increase in suicide overdoses.
So where somebody they plan to commit suicide, they're using drugs to do it, and it's very intentional. They're taking enough that they know or they feel certain it's going to kill them. So they're still dying of an overdose, but it's a suicide. It's an intentional overdose as opposed to an accidental.
Correct me if I'm wrong, Jennifer, but I do believe that when our medical examiner rules it as a suicide by overdose, it doesn't then show up in the data of overdose deaths. Or am I wrong there?
I believe it does.
Oh, okay. Well, I'm being
learn.
wrong.
Yeah,
It's fine.
We're all learning here
Yeah.
tonight. That's
Yeah.
good. It's an education for everyone. So Well, that makes sense. I've got to imagine it's tough for a coroner to, because we don't have a medical examiner in Winnebago County.
We do now, yes.
Okay, all right. Oh yeah, after what's his name? Yeah, that's another story. We won't go there. But so we've got a medical examiner now, which I think is much better than a coroner. Because they've got different levels of education, and I think what they do as a job is probably more, I don't want to say legitimate, but it's probably more based on medical things than a coroner.
Yeah, and we still have to work with, toxicology is done elsewhere and autopsies are done elsewhere. But I think I want to go back to your point of suicides as well, is just the struggle with mental health that I think our entire community is facing. And, if we're strictly focused on substance use, the majority of, people that we've reviewed have had some sort of struggle with mental health, whether it's undiagnosed or untreated. And so once again, thinking about supporting people in their mental health, as well as substance use.
Yeah. How much does, we talked a little bit about socioeconomic things before, but how much does a person's education and income factor into these deaths? My thought here is someone who's highly educated, well, you would hope that someone who's highly educated is not doing this, but we've heard of it. So people, though, who are highly educated often have the best paying jobs, and so therefore they have they have more income. And is that factoring in at all that, okay, I can afford more drugs? And do you know what I mean, or am I way off base here?
I think that taking a different approach to answer your question, I think that one of the threads that we see over and over is childhood trauma, and the way that those early childhood experience and childhood trauma really impacts folks, and how that contributes to later substance use disorders and addiction, and potential for increased overdoses later in life.
And possibly suicide too.
Yes.
So, okay. So it doesn't matter how much money you're making. If you can afford more drugs, you can maybe buy more drugs, but it's really not a factor for these purposes of this study.
I think the other thing I bring up, this past year we celebrated We Heart You. We had our We Heart You event, and Vin Baker was our keynote, who did an incredible job. And at one point in his presentation, he talked about how he had a $10 million contract. Well, he struggled with addiction, lost it all, was able to rebuild his life. So I think that the connection to money is not necessarily a factor, that it impacts everyone. And once again, just breaking down that stigma of overdoses, drug addiction affect everyone.
But see, he had a $10 million contract, and he still ended up losing it all, probably because he had more money. He could buy more drugs. He could buy, do you know what I mean? Maybe I'm not explaining it right, but
I'm grateful that City Media actually recorded his keynote, and I highly recommend.
What's his name? Vin Baker?
Vin Baker. Yeah, okay. He's one of the coaches for the Milwaukee Bucks, but his story is incredible, and I think once again it just shows, the job of our community is to offer resources and support people, and this idea of We Heart You, that providing unconditional love and attempts and breaking down that stigma that no matter who you are struggling, that we're there for you as a community.
Sure. So as a team, you guys meet once a month and you review, I'm assuming you get statistics on a monthly basis, and so you review those then. Are there, when you're reviewing these deaths, whether it's monthly or annually, once you get this report, are there certain themes or characteristics that kind of go along with? Oh, it's in there. Okay,
yeah, we have a slide for you. I love that
too. Let's bring that up.
That was the perfect lead-in.
There we go.
Well, so these are just general notes about the report that we want people to know. So obviously there's a huge, increase in deaths that are very concerning, and reasons why we bring attention to this and coming to your show. We talked about the suicide deaths and suicidal ideation, especially with non-fatal overdoses. We talk about how this is similar to past years, fentanyl being, the most common substance that people have struggled with addiction. It's not always just a one-time thing. and then really focusing on how we can make sure that people get the mental health resources that they need.
Okay,
Yep.
So let's go on to the next.
So these are the themes. Yes.
Okay.
So these are the themes, and I'll touch upon them, and then I'll have Ashley add, any other thoughts she has. But the first, we really talk about children being left behind. When we talk about childhood trauma, we think about children that are at the scene of overdose deaths, children who've lost a parent, which are great from overdoses, but also thinking about the decedents, how they themselves are victims of childhood trauma. So really thinking about how are we supporting these kids to break this cycle and make sure that even though they're experiencing this childhood trauma, that we give them the resources they need to be successful later on. We talked about the history of mental health disorders, many not receiving the treatment that they needed, whether it's undiagnosed, not treated, that this is a great area that we need to focus on in the future. We talked about the gaps in access to treatment and basically, this idea of continuum of care, right? So there are lots of different kinds of treatments from inpatient to outpatient to support groups in different ways. And so making sure that we provide that continuum, no matter where somebody is on their addiction journey, that they get the resources they need.
Okay.
And then finally, and I think this is, I keep bringing up We Heart You, and that's on purpose, that people feeling isolation and no support. We have continued to see that people are dying alone, not necessarily having access to Narcan, but not having people in their life that really could support them so that they can do well.
That is, it's just sad all the way around. But this one in particular, I think, saddens me because it's a shame to feel that isolated, that you just have no emotional support, no physical support if you've got some kind of other ailments going on. To feel that alone and almost like you're on an island by yourself. Mm-hmm. Like if Gilligan was on the island by himself and the professor and Marianne, they weren't there with him. None of them were there with him. He's just there by themselves, and that when I look at that one review or that theme, that's what I think about. I think about someone just being so isolated that they don't even really see the world around them, I don't know. That just makes me very sad. So what is your team doing to, in this particular case, get these people more involved with other people so that they don't feel so all alone, so that they know that, hey, there's someone out there who gives a crap about me, or someone that I can talk to when I'm feeling really down. What kinds of steps are you doing to fix that, and then some of the other things that you guys are doing to bring those numbers down and so forth? Who wants to take that one?
Why don't you start with
that
the
was a
therapy, and then I'll talk about our
Yep.
programming.
So I think I would say three different things. Actually, I'd say four. And the first is that it doesn't just have to be us. So we as a community can do something about this, right? Offering hope. I think so often, when you talk about isolation, someone that is struggling, who's probably burned a lot of bridges, who is sick, probably has a lot of shame that they feel in our community saying, you're bad because you use drugs and you struggle with addiction. So instead of doing that, saying, hey, I'm here for you. How can I help you? And that goes into the other parts. This idea of We Heart You is, it doesn't matter if it's 2 or 3 or 10 times that I'm offering you help, that the door is open and connecting. I think that's a big thing. We created the We Heart You app last year, which is a great resource, talks about substance use disorder resources throughout the Fox Valley, Outagamie, Calumet, and Winnebago County. It has that, and we're talking about expanding it across the state. But one aspect is the peer support piece. So people are isolated because they can't talk to someone. And if you're struggling, thinking about talking to someone who's been through it. So, the training that Solutions Recovery always talks about is, if you were a law enforcement agent or you were a firefighter at a wedding, if you saw someone in that same field, that you immediately have that rapport. And with our app and with the peer response team out of the Solutions Recovery that we've talked about being a major project through OFR, is connecting with people who've been through it. And on the app you can talk or chat or text them. So whether you're struggling or you're in a good place and ready for help, that's another way you can connect. But I think that the main thing, and then I'll turn it over to Ashley, is continuing to provide people hope and letting them know that they're worth it.
Sure.
I think the piece I would add to that too is helping people find hope wherever they are at in that journey. And I think from a public health perspective, that's really the piece that we've taken on through our harm reduction program is, around the table of OFR, everybody has a different piece of this puzzle and a different part that they play. Right. And public health part is harm reduction. Yeah. And so the environment that we're trying to create with the people that we are serving is to just meet them where they're at, wherever that is, and then help them along that journey. Yeah. So it's a safe and judgment-free place where folks that are using drugs can come and they can meet with somebody with lived experience and talk through whatever is going on and get the supplies and things that they need to keep themselves as safe as they can until they're ready for that next step.
Sure. When we don't need to go back to it necessarily, but that graph with the age groups broken down, you'd have to almost gaze into a crystal ball here, but maybe you have some light that you can shed on this. When I think about people 65, 60, 65, 70, I think for them, they could very well be overdosing because your eyesight goes. You forget when you took something the last time, and so you're thinking, oh, geez, did I take this? Well, I don't remember, so I'll just take another one. And, I can easily see where something like that's happening. But then again, I look at how prevalent the fentanyl is, and I'm thinking, okay, are people of my age group actually using fentanyl? And I guess I see you shaking your head, yes, so...
And I think
that's surprising to me.
I think that there are a lot of assumptions, even with some of our partners too, that older folks would also be overdosing and have been surprised when they've come across cases, assuming or family says, "Oh, there was no history," and then sure enough, it was. So I think once again realizing that isolation piece too, that plenty of older folks live by themselves and feel just as depressed and struggling with, and I shouldn't just say depressed, but struggle with a lot of things such as addiction.
I think in addition to that, what you were describing before happens too, and that's why one of our big strategies has been naloxone saturation, to get Narcan everywhere in the community, so anytime that those situations arise, that there's an overdose, that there's enough Narcan around that somebody can assist.
Can someone administer Narcan to themselves?
I mean, see how it would be possible. If I gave you Narcan, you could administer it to yourself right now, but if you're overdosing, you're not going to be able to administer Narcan. Okay. And so that's where we want folks to be trained in how to recognize an overdose. So if they see those symptoms, they can administer Narcan.
But if people are so isolated, they're not going to have anyone around necessarily to recognize those things.
There's some really great services. So from a harm reduction standpoint at Public Health, we really encourage people not to use alone. Never use alone is actually language we use pretty frequently. And there's a hotline too, never use alone. So if folks are going to, they can call a phone number. And
what's that phone number, do you know?
I don't know it off the top of my head, but I certainly can get you the resource. But it's neverusealone.org is the website. And somebody will stay on the phone or on video with them.
Never use alone.
Yes. Okay. And if they begin to show signs of an overdose, they will alert EMS so somebody can come and give Narcan. Okay.
And Jennifer, you mentioned about the We Heart You app. Yep. I know we have a weheartyou.org, and we got it up there right now. We've been putting it up. So the app, is it that same one, We Heart You?
Yep.
You go into
We Heart You app. Store? Yeah, so if you go to weheartyou.org, you could do /app. So one of the tabs actually has everything about the app. You can also see where we have our t-shirts, you see about our events, see about our award that we've given in the past to community partners, and really learn more about our work. But yeah, the app was something that we debuted last year that we were really proud of and continue to work on.
Well, and I hope that I'm going to download that app when we finish with this, but and I would encourage everyone else to, but there's another app that I would encourage people to use. I'm an iPhone person. And so I don't know if Android people with Samsungs or whatever, I don't know that they have access to this app. But there is on iPhones an app just simply called Health. And I use that thing religiously because it's got all kinds of health-related information on there. But there's a place where you can enter all the various medications that you take and what times of day you take them. And then it'll pop up as an alarm when it's time to take it. And then you just press the button that says taken. And it'll give you the exact time that you took it. And I love that because there have been a few times, I mean, I try to put down when I'm taking even if it's just an ibuprofen, I'm putting it down, and I do that because if something happened to me, I was in a car accident or something that was pretty serious, and I can't speak for myself. I want someone to be able to access my phone, which my family can, and say, okay, at such and such a time she took this, at such and such a time she took that, so that they know what's in my system. But I also like it for myself because if I forget, and it's not like I'm losing my mind, but, when you've got so many things going on in a day and you're just pedaling through the day nonstop, and I do forget from time to time. I think, oh, geez, I took that, but I forgot to mark it down, or I forgot to take that, or whatever. And as long as I know it's being logged in my phone, I can just go back and look. And I would really encourage folks, whether you're listening to this on the radio or you're watching us on YouTube or cable access, whatever, if you've got an iPhone, really look at that app. It's a free app. It's standard on the phones. And it's instrumental. So get that and get the We Heart You app.
Yep,
So,
and that's also free.
Yeah.
Yep.
It's good
and
when
filled
things are
with
free.
tons of local resources.
Yeah.
It's really quite the
Yeah.
app.
So let's talk about what, not just what you guys are doing specifically to help bring these numbers down, but then I also want to talk about what we as a community can do, because it's, it could be family, it could be friends, it could be our next door neighbors.
Yeah.
And I think when you live in a community, whether it's a city, a township, a condominium community, wherever it is, those people are all your neighbors, whether you know them or not.
Yeah.
And as human beings, I think we have a duty to help each other when and where we can, and to be on the lookout for weird things that happen. And I don't know. So first I want to know what you guys are doing to try to bring the numbers down, and then what we as a community can do for our family, friends, neighbors, and just fellow community members.
So I think we have a slide that should list.
Alrighty.
Very prepared.
Yeah. So
Moving forward.
Look at that.
Look at that.
I would just say that there are so many different things that could be done. So when you say, what can you as an individual do, please share your thoughts and continue working on what meets with your skills as well. But for our OFR team, we're going to look at closing the gaps in communication between systems. So basically thinking about, with those 47 partners representing 35 agencies, with all of us, having our different sector, how can we create that continuum of care and communicate better so that people can get the help that they need and not fall through the cracks?
Okay.
That second one, as I already talked about with childhood trauma, thinking about those kids that keep falling between the gaps, and thinking how we can support them, whether in a school or whether with CPS or working with the health department or healthcare or police or whatever it may be, but how we as a community can come together, once again, support these kids, address the childhood trauma that they may be experiencing, and provide those supports. The last is focusing on the preventative efforts. And, Ashley talked to some about this, and I'm sure she could talk a lot more about it too, but I think about, I use this analogy a lot of how, we have a dartboard, but we're not going for the bullseye, because the bullseye would say that treatment is one effort. Instead, we're throwing as many darts as we can up there, knowing that everyone's journey through addiction and recovery is very different. And those preventative efforts are so important. So whether it's thinking about childhood trauma or, PTSD or some other trauma that people are experiencing, or thinking about substance use at an early age, or that first time or whatever it may be, really focusing on those intervention points.
Okay. You guys keep mentioning early childhood trauma. I'm trying to wrap my head around that, because I suppose that could be almost anything, couldn't it be?
Mm-hmm.
Give us some examples of what that could be.
So I think probably the easiest way to explain it is to talk about ACEs. Are you familiar with the Adverse Childhood Experiences inventory?
What's it called? ACEs?
ACEs, yep, Adverse Childhood Experiences.
Okay.
And it's a survey with a lot of research that has been done on it, some of which has been done very locally. But it looks at all of these different ways in which children have adverse experiences growing up, and things that can, especially when added together, impact health outcomes in the future. And so they're sometimes really big, sometimes small traumatic experiences. So sometimes you're talking about abuse in the home. Sometimes it can be being the child of a caregiver with a substance use issue or an untreated mental health diagnosis, experiences of racism, a parent being incarcerated. There's all these things that kids can experience growing up, and when you begin to tack on additional adverse childhood experience, so these traumas over and over and over, they really have a significant impact on your health outcomes later in life. And how that is tied to substance use and mental health is it really increases your likelihood of it developing, or your risk factors more so for identifying. Wow,
yeah,
words.
You got it.
It's catching. It started with me, and it's gone that way.
Skip it. No,
your turn.
We're doing clockwise. You're next, Jennifer.
Your risk factors for developing mental health or substance use disorder later in life.
Okay.
That's why I brought the social worker with me in the mental health. She's got that.
I just can't talk.
Now, if we could just get a speech therapist in here, we'd be in good shape. So it could be molestation.
Yes.
It could be maybe they're being physically abused or emotionally abused.
Yep.
It could be where one or the other parent is being abused, and you're just seeing that, or hearing it. One way or the other, you're experiencing it. It could be almost anything, couldn't it?
Yes. And I think that the things that you're describing are kind of the ones that we would consider typically known traumas, areas of abuse. And I think what we're learning, especially the more that we dig into child trauma and the data around child trauma locally, is that there are so many factors that contribute to traumatic upbringings. And a lot of that is societal factors and systemic factors outside of just what happens to a child in the home.
Yeah. What about a kid who's being bullied? And it could be any age, really. Is that considered childhood trauma?
It certainly could be. So I think the thing about childhood trauma is that there's not one really good, really specific definition of it, right? There's the clinical definition when you have symptoms and you're being diagnosed, but there's a whole myriad of factors that go into that resiliency factor and how much resiliency someone has kind of coming out of a traumatic event. And that's the support of the community, the support of the people around you, the ability to access the services that you need. And so rounding back to your question before on what the community can do, these are the things that the community can do.
Do we have a slide for that or no?
I believe so.
All right. Well, what's our, here we go, right there.
Too.
And I think that might be the last slide that I have from you guys. So it says download the We Heart You app. Okay, got that. And talk to us about the other two then.
So at the Winnebago County Health Department, we provide Narcan, which is we provide nasal Narcan. So it's an easy to use tool that can save somebody from dying of an overdose. And it's 100% free. We can train anybody on how to use it. We can give it to anybody that shows up at the health department. And so we really encourage folks to learn how to use Narcan, to learn the signs of an overdose. Come visit us so we can talk to you about it, because you never know when you're going to come across somebody that might need that service.
So you would train them on how to use Narcan?
Yes.
And then the fentanyl test strips, those are free also, it looks like.
Yes.
And what are those? Are you're testing something to see if it has fentanyl in it?
Yes. So
even just a slight trace?
Yes.
Okay.
Well, so there's a lot of nuance to it, like anything is. So we're using the fentanyl test strips to really encourage people to understand a little bit more of what's in their substance. And so there's many, many different types of fentanyl. The fentanyl test strips, unfortunately, only test for, I think, 7 of all of the different types of fentanyl. And so it's not going to catch everything, but it's a really good harm reduction tool to just give people some ability to test and get a result and then make some decisions on kind of what's going to make the most sense and what's going to keep them safe in that moment.
Okay, and then let's go back to that so we can finish up that. There we go. Connect with someone. Tell us about that.
Yeah, so the Solutions Peer Response Team is a program that was started in 2023 in September, and so that is the team that I was talking about before, a type of rapid response model. So they're available 24/7, and they're people who are in recovery, trained recovery coaches that can meet you where you're at. So it could be through the We Heart You app, or you can call that phone number. So you may be struggling, or say you have a child or a friend that's struggling, you can contact them and say, hey, I'm ready for help, or, how do I get to treatment, or I'm in crisis, where should I go? And so this is a group that you can connect with that are trained professionals and can get you the resources that you or your loved one needs.
Okay. Is that a local group or is that a national one? Okay.
Nope, so it's out of Solutions Recovery.
Oh, okay.
Yeah.
All right. And where was I driving? Just the other day, and I saw them. They used to be more downtownish, or on the east side of town.
They're on Evans Street.
Now they're on, Evans.
Yeah, and they have a new beautiful facility, or at least the front introduction. So they've got a free coffee counter and have meetings every day of the week and a lot of events. So if you're trying to find recovery, they offer a lot of resources.
Okay. So I'm going to play devil's advocate here. When I heard about it first, and then I actually had a physical experience with it. So I had, my doctor had prescribed a narcotic. And I usually get drugs through the mail or whatever, but either way, with the prescription, they also gave me some Narcan. And I didn't even know what it was at first. I'm like, what is this? And I'm looking at it, and I'm thinking, well, first of all, what the hell is this? And how am I supposed to use it? And what do I do? And then, like a dummy, it said not to press it, but I pressed it anyway. So I see this fog of stuff go through the air, and I'm thinking, okay, now am I and the dogs, are we in trouble now? Or we got out of the room because I didn't know what it was going to do. So there was one left. I'm sure by now it's out of date anyway, and I should probably just turn it into the police department. But I thought, why are we giving out Narcan? So here's the devil's advocate thing. If we're making Narcan free to the public, and people who are using know that it's available, are we not kind of encouraging them, or some, to use even more because, well, you know what? I got this little angel sitting on top of my shoulder called Narcan. That's gonna watch out for me in case I OD. Am I wrong in that thinking, or does it track somehow? I'd like to think I'm not too far off base, but maybe I am. I don't know.
A couple of things that I think are important to remember is when people are using substances, they're using substances because they have a disease of addiction, not because they want to overdose. It's because of the disease. And so there's that piece that I think is just that really important baseline consideration. The other thing that I'll offer too is that, from my understanding, overdosing and being brought back by Narcan is a horrible experience. Using an opiate gives people a high, it makes them sedated, and Narcan blocks all of those opioid receptors. So it is going into immediate withdrawal from whatever substance they were taking, which can make people feel really, really, really awful. And so we do hear that a lot at the health department is, it's enabling, or it's giving people more license to do things. But I think the reality of the situation is that this is a life-saving tool that is really used as kind of a last resort in that option of an overdose. And ultimately, people can't recover if they're dead.
Yeah.
And so we want to keep people alive. So when they are ready, when that window of opportunity presents itself, that they are ready for treatment, we are there and ready to get them where they want to go.
So I know of one person who has been in and out of jail. He's been to prison already. He uses all the time. And I understand addiction's a disease. But I do think that there are other people out there who aren't necessarily addicted. They just think, I'm just going to do drugs. I'm going to get high. I'm going to do whatever. But even if they're addicted, they might, see, I'm thinking, okay, you're addicted. You know you should probably get some help, but you don't really want to get some help. And so you're just going to keep using because you're embarrassed to seek help. So you're just going to keep using. And oh, by the way, it's okay because there's this Narcan that can help me. You know, that's kind of where I'm thinking, but I do understand it's an addiction for a lot of people and they just can't shake it. When we talk about getting them mental health help, that's a great idea in theory, but, you know, and on paper, but in reality, let's face it, every one of us in this room and at this table knows that there's not enough mental health counselors to go around, not by a long shot. So if people are struggling, they want to get some help, but they can't. I mean, everybody's backed up. You know, I talked to someone the other day who wanted to get a medical appointment for whatever, and they said, oh, the soonest we can get you in is November. Well, excuse me, you've got a health issue right now, you know, and I'm sure it's the same with mental health. At least to get that initial appointment, and then it might change. But what kind of services for mental health do we have in Winnebago County where people aren't going to be running into those roadblocks of having to wait a long period of time, which in that amount of time they could overdose?
So I think that while all of those, all of the things that you described definitely do exist, we are also very, very lucky here in Winnebago County because of a lot of the different initiatives that have happened, some within OFR, some outside of OFR. We've really built this system of people being able to at least get some initial contact when they need to. I'm going to let Jennifer talk all about the Solutions Peer Response Team. But within the county, we've opened up, or not we, I'm not part of the department, but Human Services has opened up the Connect program out of the Orrin King building, which is really kind of a walk-in basis. So we partner with them a lot and can get people directly from our offices over to there to meet with people to talk about substance use disorder counseling, mental health counseling, actually even housing, transportation, like all of those other factors that we're talking about. And that's just one agency, and there's multiple places that are really trying to build that similar program with some navigational components to try to alleviate some of those things.
And that's called the Connect program?
Yep.
Okay.
Yeah, and then I think with the Solutions Peer Response Team, you know, even if a treatment bed isn't open, you can continue to meet with a peer and you can go to Solutions and be in a safe place. I think so often when people are struggling, they're in environments that are not supportive or conducive to recovery. And so going to Solutions or connecting with a peer wherever you are in your journey or going to the harm reduction office at the health department, there are people out there that care about them. I think the last thing that I would say, because I don't want to be, remiss this option or whatever it is. But I think I'm really lucky because I do not have lived experience. I have not struggled with addiction. I'm not in recovery, but I have over the last 6 years gotten to meet some incredible folks, both that are struggling and those that are, doing well, and also knowing that they are one drink, one drug away from continuing with their addiction. But I think that is like so many of our health issues, right? I wish, the brain is a powerful thing, but, and there's some days that I have motivation to exercise and some days that I have motivation to do well or meditate or whatever it is. And I choose not to. And I think, so I think that there is still so much stigma of addiction being a choice, and it is not. Because I've heard so many stories where they have lost everything, including their family and friends, and they say, I do not want to do this. I do not want to take this drug. And so for us to shut the door and say, good riddance, that is not what our community does. And that's why, we continue this movement of having those open doors so that when people are ready to get the help that they need, it is there, because we know that window can be very limited at sometimes too.
How much are either of you seeing of cases where someone, I don't know, say they just want to smoke a joint, but that is somehow laced with a little bit of fentanyl? So how much are you seeing of cases where people were trying one drug, but they ended up becoming addicted to fentanyl because it is so addicting and all it takes is just a little bit? Are you seeing a lot of that or not so much?
I think that what we are so I wouldn't say so much, I don't know that we've directly heard that there's fentanyl in marijuana, but I think what we are seeing and hearing more of is that the overdoses being connected to other substances. So I thought I was using cocaine, but it had fentanyl in it. I thought I was using so pressed pills are really big, and they
pressed pills? What are they?
So if we'll say youth, because this is one thing of I'm going to take a Xanax.
Yep.
And then a press pill is something that's manufactured by drug dealers. This is what I'm looking at.
That looks like a Xanax.
Exactly like a Xanax, but it's got fentanyl in it. And so this is why, we're seeing a huge increase, because fentanyl is being laced in drugs that people had no idea.
Right.
And some people do, but making sure that our community has naloxone available so that whether you intend to use or not, or you have a parent that is struggling, that you can save their life, whatever it may be, that our community has these tools that we need to save lives.
Okay. All right. Well, we're down to about 2 minutes. So why don't we kind of wrap things up? Is there anything else in the booklet that you brought that we should mention?
So I think the only other thing that I'd love to highlight, because I think we've done We Heart You enough and what you can do, but and I don't have a slide for this, but we talked about the ripple effects of our OFR. So our OFR team has been working, like I said, for 6 years, reviewing these cases, doing this work. And I think so often when I say what I do and we talk about what we do, people think that it's grim, that it's depressing. And I will just say it's full of hope. And it's because we're making an impact in our community, and if we can continue to share this message that people are worth it, and they are valuable, and we are here to help, that's how people get better. So that's what we've seen, the changes in our community, that even though this number has increased, our prevention efforts have really paid off, and we're doing good things.
Sure. Do you by chance, you talk about ripple effect, do you by chance have any statistics that you can pull off the top of your head real quickly of when people are using drugs and not ODing, but yet they can't go to work because they're too strung out or they're too hungover or whatever the case may be? Do you have any numbers to show what kind of a financial impact drug use is making on our community?
I do not have that number.
Not off the top of my head, no.
Well, I'll be getting on YouTube, or not on YouTube, I'll be getting on the internet when I get home. Maybe YouTube has something, I don't know. But
check out weheartyou.org.
I will do that in the process, yes. So, okay, any parting thought just real quickly? Check out the We Heart You app.
Yep.
That's the big thing.
Come and get some Narcan. And I think embrace the We Heart You motto. It is okay to just be supportive and care about the people around you and your neighbors. And
fantastic. All right. And if people want to, they can go to YouTube and look up Vin Baker. I'm assuming that's VIN.
Yeah.
Okay.
Yeah. Or the weheartyou.org. We have all of the
through there. That would be the best place to go. All right, guys. Thanks so much for being here.
Thank you so
Thanks
much.
for having us.
I have learned stuff tonight. We haven't solved any problems tonight, but maybe we have.
Maybe we have.
Maybe we've educated some people, and this is going to make a difference for them in their lives. So, all right. Thank you again. Thanks to the crew. Also, thanks to all of you. We will see you next time. Until then, take good care. Keep your eye on us. We've got our eye on Oshkosh.